And we started care with Andy because he was having some issues with his neck, was becoming uncomfortable. He's got a history of surgery on his low back, which was actually successful. His low back as a whole has been doing really well. But when we first met, we talked about how because he's had surgery in his spine, especially in the lower back, now his neck is going to be more likely to have some problems as he gets older. And so we're looking to avoid that. Andy's active, running, working out, staying in shape. And so our main goal here is, one, we're correcting what we initially found in his neck when he first came in, and also focusing on making sure as he's getting older, he's able to continue to work out, stay active, stay in shape. Okay, Andy, I'll have you turn your head to the left, then to the right, head straight. So we're going through our protocol here. We're going to find exactly what we need to adjust on him today. We always want to do a nice objective examination to know what we need to do. And so it looks like today we are going to start, just keep breathing, Andy. We're going to start in the cervical spine right at C2 today. And as always, we're using our integrator to adjust Andy. It's a great tool. It's very precise. It's very gentle. We never twist or pop his neck. Also, most people who have had surgery on anywhere in their spine are often either afraid to go see a chiropractor, or unfortunately some doctors would tell them not to go see a chiropractor. A large amount of my patients have already had surgery on their spine. You can still get adjusted. It's perfectly safe. In fact, it's extremely beneficial to make sure your spine continues to stay healthy. So going up to T1. So we did C2. We adjusted his sacrum. Take a deep breath in, Andy. Let it all go. So now I'm looking at his rib cage. I'm always working on ribs. I want to make sure every rib can move as much as possible. The ribs are losing their full range of motion. It's obviously harder to get a nice, efficient, deep breath, but one, it can be painful if the ribs don't move properly, but it can then irritate the neck muscles, the low back, the hip flexors. Take a deep breath in. There we go. Let it all go. Most people with low back pain, type hip flexors usually have an issue with their rib cage that doesn't move efficiently, which affects their diaphragm that is connected to their hip flexors. Take a deep breath in. There we go. That looks really good. So now we'll look at how the hip flexors and legs are moving. Lift here, Andy, and lift here. Which one feels heavier? Either one, or they feel the same? Okay, that's good. That's what we want.